offer emergency dental care because it's important to know what to do if an accident happens or if you have a problem. It could make the difference whether or not you save your teeth or you may lose a tooth. And it's important to understand what is vital to go to an emergency room as opposed to seeing your dentist the next day. If there's bleeding or a lot of bleeding, or if you have a temperature or other things involved, then you would want to go to the ER as soon as possible. It's normal to have a little bit of bleeding or a little bit of pain, but if it increases the bleeding, or if bleeding increases, or if your pain increases tremendously, then it's important to seek emergency care. So the cutoff would be is if you had surgery done in your mouth and the bleeding, it's normal to have a little bit of oozing, a little bit of bleeding, but it should taper off by the end, within maybe 4 or 5 hours. If, however, bleeding starts to increase or it had already stopped before and now the bleeding occurs again, sometimes you can stop bleeding with, let's say, just having a wet tea bag. You can bite on, and there's natural coagulants in that tea bag, and you don't need to go to the emergency room. However, if the bleeding continues and you can't get it to stop with just biting on gauze that you were given, or this tea bag suggestion, that you should go to the emergency room.